You're in New York, which is not a conservative state. You're in an upstate part of it there in Westchester County and so forth. Really, what do you think is going on with Obamacare among your constituents?
Well, it's deeply unpopular, Roger. I was just talking with some constituents earlier today, and you know, their insurance premiums have gone up, which is not surprising when you consider that private insurers are anticipating correctly that they are going to have to provide for a lot of their insurance with a far smaller base of participants because employers are going to be leaving their employees to the public system, to the public exchanges. We know what's going to happen, and it's going to make paying out benefits for the private insurers that much more difficult, and it's going to make private insurance that much more harder for people to afford.
Now, and Congresswoman, then, what do you think? I mean, if you were able to, you've been in the medical system now for a number of years as a professional, and what would you like to see happen here? Let's assume that the Republicans get a shot at restructuring, replacing this whole thing.
Right. Roger, 4 key points. 1, make health savings accounts the standard for people to pay for their health care. It's consumer-driven. It allows doctors and patients to make the decisions, and we have a model where it has worked very well. Healthy Indiana, which is a program that the state of Indiana put together for Medicaid recipients and state employees, and it's worked great. So that's number 1. Number 2, open up the insurance marketplace so that people can buy insurance across state lines, which they can't do now. And that makes their own insurance very costly in a place like New York that has lots and lots of mandates. That's not fair to people who find it otherwise very affordable if they had more choice. So that's point 2. Point 3, real liability reform, which we certainly don't have with the 2010 health law that massive case over, but it can be done and it needs to be done. It adds tremendously to the cost of care. And point 4 would be for folks who really have trouble finding insurance, fund high-risk pools. We could do that for a fraction of the cost of a massive law that's putting federal bureaucracies in the place of doctors and patients making decisions.
Congresswoman, then.
Even I'm telling lies.